So this is a short overview of the profile setting sheet and just gives you an insight on how to write the profile sheet. Now this is going to be the first part of your coursework. So one of the first things you include in your project will be your profile setting information, and then it will go into the context and introduction as discussed in the overview video at the beginning. So a key thing about writing this P1 unit is choosing an organisation and writing your profile sheet. Now the first thing you need to do is spend some time and pick an organisation that is going to be helpful when you're writing your project. So you need to be careful about what setting you use. Now we would recommend using your local doctor's surgery, as you're more likely to come into contact with it. You've probably been there, or you know someone who's been in, so you're going to be more familiar with that setting. And again, it's the idea that you'll have contacts, people like within your family, or people you know who've gone there. You'll be able to get maybe some insight from different types of patient going in that could fit your client groups, because you may want to choose to get some sort of anonymous sort of feedback from your grandparents who go to the same doctors as you, or your older sister, or your I don't know, your mum or your dad, and how they've experienced the doctor's surgery. You can choose other settings. You can choose a hospital later on in the project if you wanted to, but generally doctors is the key one we would say to start off with. Now once you've got your setting, obviously you might want to look on your website, think about how easy it is to access and find information. Is it too hard to get information? A lot of the information is about the NHS, so think about what information's been pasted on the website. And you might want to know about the services they offer, the staffing, the time arrangements, the facilities they offer. What information is there for social groups like different ethnicities, different religions, different sexualities. Now what can you find on that website? So it'll be a case of going through the website and pulling all the resources, all the information you can about your setting. Now there is a profile sheet that is really helpful for you. Once you've chosen your organisation, you can go and fill that in, and that will give you a bit of a foundation for writing your coursework. Now your P1 sheet, that is going to be collected and checked by your teacher within the next sort of week or so. So what I would say, and it's a very early task, is this is probably a good thing to start with, is thinking about who you are going to be writing about, and also you're going to need your P1 sheet at the beginning of your coursework as part of your introduction. So there is a template to use, there is a worksheet to use. I would say look at that, and that will help with organising and structuring your write-up. Now, if you're struggling to find an appropriate organisation and appropriate surgery, there are a couple of links here. These are good examples of surgeries because they have good website links. And again, although we say a local, if you can't use your local one, then you may want to use these. Again, just make sure you do your research thoroughly. Now, one of the things you'll be given is a profile setting sheet, as you can see on the left of the screen here. Now, this is really helpful for writing your project. And what you have are 6 very simple questionnaire styles that just ask you to talk about your setting, think about what's going on there. Now you can use this as part of your introduction, or you could expand on it. So ultimately it's, what is your organisation? Why have you chosen it? Why have you chose this setting? Is it local to you? Do you go there? Does family go there? Is it specialising in a particular area? Now we would say your GP would be the best thing to use, but you can use other settings. If you know someone who works at a hospital, if you can get some information. But GP we would suggest is better, just on the basis that it's not too big and hopefully offers a range of services. Now question 3 asks you to think about how you're going to do that research. You're going to go on the website. Are you going to speak to patients? And those patients might be your brother, your sister, your mum, your dad, your nan, your uncle. Get what was their experience of going to the GP? What did they find? What was their experience like? What are their thoughts and feelings? Now you can write down some notes on what they've said, or they can write up a summary and you can put that into your work as an evidence of local feedback. You just anonymize it. So you'd put patient X, male, 26, patient Y, female, age 79, and that's all you'd have to do. anonymise it. Now you can speak to staff if you know any. So if you know anyone who works at the GP, you can ask them. If you go to the GP yourself, you can put your own experiences of attending the GP, or look for other things like feedback online, or patient surveys, or NHS information on the setting. Now, other services that they offer, this could be talking about other services, other specialisms like diabetes clinics, any maternity services, any weight loss, what else is being offered. Do a staff profile. Who are the staff members? How many doctors? How many nurses? What are their specialisms? What do they do? Are there any other services, any other staff like dietitians that are based in the setting? And lastly, location. Where is the setting based? How many people attend there? What's the general population like? What's the area like? So again, a lot of this will form a basis of your overview. Now you can use this questionnaire once you've filled it in, or use this as a basis to write sort of 1 to 2 pages summarising your local setting. There's a little bit of detail on that coming up. Now, one of the sort of examples I've got here, this is my local surgery, and I wrote this a few years ago, but I tried to overview a little bit about the practice. So I went on the website, I've gone through the tabs and the pages, I've looked at the staffing, I've done a little bit of wider research about the setting, and as you can see here, I've talked about what the surgery is, where it's based, I've talked about a little bit about the population and the area that it's servicing. I've talked about the patients, the doctors who run the practice. I've talked about the staffing. I've got the screenshots here, lists of what services are being offered. I've got stuff about repeat prescriptions. I also did a little bit of research on Google, so as you can see, I looked at peak times of when they're being used. I looked at a road map or Google Maps and tried to identify stuff like bus stops and other nearby services that could be linked. And then I did a little bit of research about what the practice offers. So as you can see here, I sort of obviously had a look at my practice, and it talks about the other groups that use the open space above the doctor surgery. So again, like alcohol support, Macmillan support, depression, obesity, NCT. So again, a wider range of services available at the practice, not just specifically healthcare related. Another good thing to do is to go into your practice. So next time you're there, or your mum goes in or your brother goes in, ask if they can take a picture of the notes board. Again, it might be ask the receptionist if you can do that. And I know in the current climate this is pretty tricky to do, but there are loads of different services and support groups and other things that are being offered in your local area via GPs or via referrals that aren't always available or listed on the website. And again, these things update and change. So again, this is the notes board from my local GP, and you can see the range of services that are being offered there. Other things that they offer in the practice, again, not always mentioned on the website, but they have some the youth inquiry service, the Yes Sexual Health support groups that work in the practice. There's stuff about domestic abuse. There's obviously information about their extended hours and some of the things they do during those what they can offer and what they can't offer. As you can see here, the list of what they do not do during the extended hours. So again, this is stuff I found in the practice, and it's worth going to your GP to look for this information. The final thing just to flag up here is that obviously outside of my practice, you've got this big poster here which highlights that my practice is a needs centre, so the North East Essex Diabetes Service. So again, a lot of diabetes specialism, but also in terms of wider youth services, obviously looking at stuff like privatisation, marketisation, which we'll talk about later, which is run by Virgin Care. But this was obviously, again, wider support, so more about the holistic support of emotional support for young people there.